What are the risks of topical corticosteroids?
We know that these are medications that can be really very good in eczema, and that overall, we wouldn't want to give up that option of treatments because they can be quick, they can be very effective, and they can be used safely. So it's really about matching the treatment to the active condition and then understanding how to use it over time. So topical corticosteroids are a class of medications that does have an effect on not only the immune system of the skin, but on the skin cells themselves. But when it's used on active eczema, until the skin is smooth, you're really mostly treating that inflammation or that immune system. And that if you can use your topical corticosteroids twice a day or at the frequency it was prescribed until the skin feels smooth, and then gradually reduce the use of that cream, that you're usually going to have a really good way of treating your skin simply because these are medications that are also widely available. And, many of the people that you'll see on the front lines, so the family doctor, the emergency doctor, and these other physicians or nurses that you may be encountering are actually a lot more comfortable with the use of these creams. So they can be really great options. I think that one of the main principles to remember is that any medications delivered through the skin, you generally want to start with, a good treatment. So twice a day in enough of a thick layer that you're covering the skin, and then to gradually stop it over time. And many people will need to still continue to use it maybe once or twice a week on areas that they know are always going to be active, or you would treat that cream as a rescue medication and then switch to another medication like a topical calcineurin inhibitor, Protopic or Elidel, or Eucrisa to maintain that skin health over time. So if you do need to use a medicated cream on your skin day in and day out, that's when your topical corticosteroid may not be the best option for you. And that's where you should be talking to your doctor about other options, because their medications as steroids are really best used to rescue and then used intermittently. And so if you need something every day, that's the time that you want to be discussing an escalation. So moving a step beyond in that pyramid of treatment that we talked about earlier. We know that topical corticosteroids, when they're used safely, really do not have any lasting impact on the skin, that they do not make you fat, that they do not lead to lasting changes in your immune system. I think the main consideration is that in children who are growing very quickly, and if we're using strong corticosteroids, remember that their strength ranges from anywhere from the floor all the way up to the ceiling. If you're using those treatments too much on skin that is sensitive, so certain regions around the eyelids, for example, or in children who are growing very, very quickly, that they can, if they're used too much every day, for example, for many, many weeks or months, then you may be actually having some thinning of the skin, and that in some patients that can lead to stretch marks, especially kids who are growing, and other changes like visible blood vessels. But most of the time, even if you do need to use a steroid, and I've experienced this myself, because you have really bad eczema and you use it to control the eczema, even if you do have a bit of thinning of the skin, it is not a permanent change, and that the skin itself is very resilient. The other consideration for the use of these topical corticosteroids is really to remember to match the strength of the steroid to the region. So many of these steroids that are available over the counter are really very, 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 very weak steroids. And they can definitely be used like moisturizing creams to active eczema. And that as you're taking each step above on your strength of steroid, that you want to be a little bit more careful. But that oftentimes when you're trying to treat your hands, really thick areas of your skin where the skin is like a wall, it's very, very thick, you really do need a strong steroid in these areas for them to be effective.